Our cardiac oncology program is a program that is designed to identify patients who are at higher risk for developing side effects from cardiotoxic medications. It also allows us to see those patients and identify if they are able to take cardiotoxic drugs.
Chemotherapy, depending on the agents, can affect the heart in various different ways. Some chemo agents can affect the heart in terms of heart function. They can sometimes lower the heart function, make the heart not pump as well as it's supposed to. Some can be acute, meaning it can happen while they're getting chemotherapy. Some could be long-term, meaning they don't manifest themselves until many years down the line, even after they finish chemotherapy. I think the most common concern people have is can they continue with their chemotherapy? I think that's the biggest concern for the patient as well as for the oncologist. And our goal is to support these patients through their chemotherapy so that they can get the best possible cancer treatments.
There are certain patients that have underlying risk factors for cardiac disease, and those patients should be the ones that have the most concern about developing problems with these drugs. Certain patients who have diabetes, obesity, strong family histories of cardiac disease are at greater risk when they receive these drugs of having cardiac problems. Those patients should be the ones that should be screened and be evaluated by a cardiologist before they receive a cardiotoxic drug.
Prevention is absolutely possible. What we do for patients who we identify as who are patients at risk, we are even more, number one, we screen them or we monitor them more closely. Patients are getting echoes probably more often than they would have otherwise while they're going through chemotherapy, depending on what kind of chemotherapy they're getting. And we also are more aggressive, controlling their risk factors, controlling their blood pressures, controlling their diabetes, to make sure their risk factors are as well controlled as possible as they go through chemotherapy.
I think that the most important thing that they should understand is that by going through a program like this, we're able to identify patients who have the greatest risk for developing cardiotoxicity, and more importantly, it allows us to monitor these patients long-term so that we can intercede with medications and treatment at an earlier date. We also know that patients have just a general fear of developing side effects from cardiotoxic medications. And a program like this allows them to have the security of being monitored by a cardiologist so that their heart disease or the development of heart disease can be treated earlier.